Hello, everyone. My name is Vasu Janopoulos. My pronouns are she, her, and I'm the Acting Deputy Director of Education at Cooper Hewitt Smithsonian Design Museum. I'm delighted to welcome you to the 2021 National High School Design Competition Judging. Now in its sixth year, we challenge teens around the country to design a healthier world for all, taking on an opportunity that so many designers and non-designers alike have been working toward achieving, particularly over this past year. So many aspects of our world are being redesigned, and we'll see how our finalists have responded today. I'm absolutely thrilled to welcome this year's finalists, the team of Paulina Caceres and Alexis Nicolo, graduating seniors at Design and Architecture Senior High, Miami, Florida. Allison Casey, a rising sophomore at La Jolla Country Day School in La Jolla, California. And the team of Aditi Jha, a rising senior at DuPont Manual High School in Louisville, Kentucky. Nidhi Malpani, a rising senior at Westwood High School in Austin, Texas. And Yasmina Muradova, a rising senior at the Gaddon Academy in Bowling Green, Kentucky. First and foremost, a big round of a virtual applause to the finalists. Their 3 entries were selected from 815 remarkable designs from across the country, submitted by over 1,100 students. It is with enormous thanks to Shelby and Frederick Gantz for their generous support in helping to make this competition possible. Before we get started with the presentations, I'd like to invite our fabulous judges to introduce themselves. We'll start with Ruki.
Hi, everyone. I'm so pleased to be here. I'm Ruki Newhold Ravikumar. My pronouns are she, her. I'm the interim director of Cooper Hewitt Smithsonian Design Museum. We have over 215,000 design objects in our collection spanning 30 centuries. It's the only museum in the United States devoted exclusively to historic and contemporary design. I joined the Smithsonian family as the director of education at Cooper Hewitt, but for the past 18 months, I've also served as Smithsonian's acting undersecretary for education. I'm trained as a designer, and I draw from my international experiences as a designer and educator to inform a human-centered approach to reimagining education at the Smithsonian. Thanks so much for having me here.
Curry.
Good afternoon, everyone. I'm Curry Hackett. I am a transdisciplinary designer, public artist, and educator in design. I have a practice in DC called Wayside Studio, where I collaborate with communities and municipalities to engage matters pertaining to culture, infrastructure, ecology. Most of that work is in the public realm. I also teach architecture at my alma mater, Howard University. And I am a core organizer of Dark Matter University, which is an anti-racist design justice academic institution. Happy to be here. I'll kick it to Josh.
Hello, I'm Joshua Halstead, pronouns are he, they. I am phoning in from the unceded lands of the Ohlone and Ramaytush people, more popularly known as San Francisco, California. And I'm an assistant professor at Art Center College of Design, where I look at the politics of disability, access, and interaction in environmental design. I'm also an instructor at Berkeley Extension, where I teach accessibility and graphic design. And I'm affiliated with the Critical Design Lab, which is founded in Vanderbilt University by Amy Hamrai, where we look at anti-ableism, anti-Satanism, anti-racism, those intersections with speculative and critical design. So, that being said, all that has to do with health, and I'm just very honored to be here today. I'm going to pop it over to Soma.
Hi, everybody. Sami Kim. I'm based in New York City at Johnson & Johnson Design, where we are focused on health and well-being for everybody around the world, looking at how to apply the design lens to understand how human values and human experiences can lead to better outcomes. And I look forward to hearing from all of you. I will pass it to Morgan.
Hi, my name is Morgan Hutchinson. I'm an emergency doctor in Philadelphia at Thomas Jefferson University. I work at my hospital in a research group called the Health Design Lab, where we teach medical students concepts of design thinking and incorporate those into their medical school education. We also run many community serving programs. Right now, I'm the medical director of both Jefferson's COVID testing and COVID vaccine programs. So very excited to be here. I loved all of the finalist projects and really enjoyed looking through the honorable mentions too. Thank you.
Thank you so much to all of our judges. At this time, I'd love to introduce you all to Alexis and Paulina and welcome them for their presentation.
Okay. Hello, everyone. I'm Paulina Cáceres. My pronouns are she, her, hers.
I'm Alexis Natharo. My pronouns are she, her, hers, and today we will be presenting to you our design called the CarePod.
So before we get started, just a little background of who we are. Alexis and I both recently graduated from Design and Architecture Senior High, where we have studied architecture for the past 3 years.
I will be attending Wellesley College where I'll be studying architecture.
And I'll be attending Florida International University where I'll be studying interior architecture.
So this past year, we have seen how important health is for everyone. Maintaining a healthy lifestyle is fundamental for our mental and social well-being. It is important to stay healthy to overcome difficulties in life, as well as preventing long-term illnesses. When we place communities at the heart of the public health, communities can engage to prevent more health inequalities and to create a more cohesive environment.
And so the main challenge that we see is that many are facing barriers that either prevent or limit their access to medical needs or healthcare. And after doing some research, we found that many people around the world can't really afford medical services, and the lack of transportation are leading patients to reschedule or miss their appointments and therefore postponing their care. We actually ran a very quick survey in our own small community and found that 77.8% of our friends and family members have canceled or missed a medical appointment in the last year.
Not only is this problem seen in the US, but also in second world countries and low-income communities. We wanted our design to be available for those who don't have the same medical access as others around the world.
And we thought, how can we expand our design not just to be for a certain population, but for everyone in different neighborhoods and environments around the world? And because of these everyday cancellations, there is around a $3 million in lost revenue each year. And to sort of fight off this problem, we are making the CarePod to be government funded, offering free consultations for everyone.
At the very beginning, we did research on possible problems surrounding COVID-19. We broke down 3 of them into mental health, social distancing, and medical pods that would accommodate to COVID-19 guidelines. On the left, you can see our research images that inspired our designs. And to the right at the very top, we have a restaurant cubicle, which we designed to create a safe environment while social distancing. In the middle, it is designed for mental health, where we created cubicles where people can talk to each other yet still be safe. And at the bottom is our design where we explore different shapes to be used as a medical pod.
In the end, we decided to choose our last design, our medical pod, but we kept elements from the 3 previous concepts, such as the colorful glass, the modular design, and the seating. The essential idea of the CarePod is to provide services without the need of traveling long distances to a hospital, and it uses an interactive digital screen that displays a virtual doctor and medical assistant. We decided on a virtual doctor instead of a physical one since it is easier to access and doctors can contact the patients at any time.
Here in the final design, you can see a full and sectioned axonometric view of the CarePod. Then you see the different elevations and sections and how we developed both the interior and exterior structure. To the right, you can see 3 different screens that will display the medical doctors.
And so before you experience the CarePod, you may either receive a brochure through physical or electronic mail, depending on the one available to you. Since many don't have electronic devices or access to Wi-Fi, a physical brochure is handed out to them, so they also receive the same service. As you see here on the right, the phone is displaying the electronic brochure, where you would be able to locate the nearest pod and the type of consultation you want to have.
And based on where you are located, we thought of various colors and materials that would complement the environment. We intend to use local and recycled material. Our CarePods will be designed based on community, culture, and weather, and offer different languages for the patients.
And so based on the location, the CarePods can be stationed in different configurations. This sort of allows for easy come and go consultations, and people won't really have to worry about waiting in line like how one normally does at a hospital or at a regular doctor's appointment. The care pods would work in a pop-up system located near populated areas as well as low-income communities.
Once we arrive at the care pod, they would walk in through the automatic door and the disinfecting agents to prevent any contaminations. Before we talk about what is inside, we want to show you the digital model we created of our design. The care pod's simple shape allows for a comfortable space for the user.
In order for the care pod to generate power, we implemented solar panels. This sort of adds to the sustainable aspect of our design, which is very important to both the user and the environment, and it is also cost efficient.
To make the design a bit more bright and enjoyable for the patient, windows and colorful glass were added to the pod. We specifically placed them around the top of the part of the wall so the patient inside can look outside, yet keeping it private enough.
The door itself also uses a smart glass technology, which can go opaque once the user is inside to provide more privacy.
As for the logo, like we mentioned before, we wanted our design to be placed at the heart of the community. Our logo shows two people in a heart-like shape embracing each other, with the title Care Pod in the center. This emphasizes how important healthcare is for everyone.
And so during the experience, here you can see the patient inside interacting with the digital screen that is controlled by voice and hand movements. The camera is located at the top of the screen, which is how the doctor is able to see you. And when it comes to virtual consultations, patient privacy and safety are the top priority. And this is why we are partnering with HIPAA, the Health Insurance Portability and Accountability Act, which is a very popular and better secured platform used by physicians to do the virtual consultations due to its security and convenience.
As for the interior design, we included seating around the sides and a connected table where you would find a device to take your vital signs. The interior is spacious enough for a wheelchair and it is disability friendly.
Here are the devices that one would use to take the vital signs. The care pod provides an oxygen level monitor, a blood pressure monitor, and a touchless thermometer. Here is a close-up of the inside with the patient interacting with the doctor on the screen. Your medical chart and other infographics will be shown here to help you with your consultation. The images could be of one asking how you're feeling from 1 to 10. It could display the medicine that you are taking or just overall your medical records.
We would have 3 main options for consultation when we arrive at the care pod. There's a regular medical consultation, a COVID-19, and a mental health. Other than the doctor, there would be a medical assistant that would guide you through the process of how to use the screen.
Since the care pod would work in a global system, you can choose different doctors from diverse backgrounds and ethnicities to assist you.
The main features included in the care pod are the disinfecting agent, the UV light, inclusive design, automatic sliding doors, solar panels, colorful glass, and devices to take vital signs. The UV light also has another function. Since the care pod is available 24/7, some may want to stay longer inside of it for their own pleasure. However, in order for this to not happen, once the consultation with the doctor is over, you have a certain amount of time before the bright UV light turns on and shines the interior pod to disinfect it. The door will also automatically open so the patients would, in a way, be forced to leave, ultimately keeping the patients going in and out without causing any problems or delays.
And regarding inclusive design, the seating next to the table with the devices to take your vital signs opens up for easier access to those who are on a wheelchair. Once the patient is done with their consultation, you may need to follow some post-visit steps, like if you need a post-checkup, a more detailed test or labs done, or if there is any medication that you need to pick up from a nearby pharmacy.
The benefits of a virtual medical assistant is that it increases access to healthcare, reduces cost, improves healthcare outcomes, fewer in-person consultations, doctors are available 24/7, and it saves time.
We really wanted to focus on the impact of our design, and with the survey that we did before, we asked our friends and family members which feature included in the pod was the most impactful for them, and 40% said the disinfecting agent. We had lots of positive feedback and many felt happier and safer with this design because of how it will influence others to get checked up more and provide more service for everyone.
So in this interior rendering, you can see the patient in action interacting with the virtual doctor. We wanted to emphasize the pamphlets that you will get once your consultation is over.
This medical information handout promotes various medical services offered and includes infographics and about medical consultations, mental health concerns, COVID-19 related topics, post-visit steps, as well as contact information. This pamphlet is a very vital part of this design since it keeps patients up to date with modern healthcare trends.
Since our care pod is open 24/7, we want to show you a depiction of how it will look at nighttime.
And here we have an artistic final rendering of how the care pods would look like in this configuration and how it interacts with the environment.
Even post-COVID, these care pods can be a vital resource for undeserved communities to receive healthcare. Moreover, the care pod can build on site anywhere around the world in state locations for extended periods of time to provide care for the entire community. The brochure is geared towards a segment of the world's population that can access an electronic device, and for those who don't, the physical brochure will come in handy.
Overall, we really want our design to provide the best service for everyone, ultimately creating a healthier world.
Thank you. And now we're open for questions.
Thank you.
Hi, first of all, this is a great presentation. Thank you so much. I just was wondering if you could explain a bit about the disinfecting agents, because what we've seen a lot of is that that's often done manually with a lot of human beings actually providing that service in public spaces.
Yes, so once the patient first goes inside of the pod, there is a disinfecting agent that will spray, so it decontaminates you, and as well as when you go out of the pod, it will spray again. And once the pod is like completely empty on the inside, the UV lights will shine very brightly, and that will ultimately like disinfect the whole interior.
The pod also has a UV light that disinfects the interior once it's empty.
I had some questions also about that. I think it's an interesting concept for sure. And I think this is something that could be very impactful, especially in vulnerable communities and in other countries and places that have limited access to healthcare or specialized healthcare. You mentioned in terms of getting patients signed up, getting patients aware of this, that it would be either electronic or by brochures. I've found that a lot of times that can be, it can be tough to limit the marketing to sort of indirect contacts like that. And so I wonder how you guys would engage community partners or others locally to help let patients know that this is available and help get the patients that are most in need this service.
Yes, so apart from the brochure that we would offer physically or, by mail or electronically, we would also use like word of mouth. If there's other patients that, are, using this product like the pod, then we will be able to have those patients tell others and, spread the word of the pod, the care pod.
The brochure physically are going to be emailed based on your location.
I have a question. A really delightful presentation and really sort of blown away by the level of clarity and sort of resolution, the sort of comprehensiveness, I think, of your proposal. And I was really struck by the way that you're framing health around this idea of care. I think that's something that's like super timely and important. When we get to I'm teaching architecture, right? So I feel like I'm in a bit of a review. So when we get to the actual pod, I think that's a fascinating sort of proposal. But what I kept wondering is, can this operate in areas that are already sort of substrates for care or areas of care, touch points for care? So whether that's a barbershop or a coffee shop, right? Places where people, there's social networks that are already in place. And so I'm wondering, did you all give any thought to the ways that you can provide the services that maybe are not packaged so neatly into this pod? Does that make sense?
I'm slightly confused, but can you repeat the question?
Sorry. Yeah, I'm wondering if it needs to be a pod, right? A proper pod that's packaged so neatly and well behaved, right? Is there a way that you could maybe take the services that you're providing on the inside? Did you give any thought to where else in the community they might be able to exist?
I mean, our main purpose for the pods were for it to be very modular and easy to like move around places. So to be located in like either populated areas, so like around malls, well, not hospital, but like malls, airports, very populated places or, low income communities. But we haven't really thought about it, but for our next iteration of our design, we could definitely think about that. Thank you.
I think that could be a great 2.0. So imagine that you had to get something set up very quickly and you didn't have time to ship a pod or however it was going to be installed. So finding where are people already congregating and what's the minimum viable technology that is needed to then enable this kind of telehealth.
Thank you.
Yeah. And also our pods are using like recycled and local materials, so it's easier to build based on the location that it, offers service for.
Hey, I wanted to, oh, go ahead.
No, please go ahead.
Well, that was a fantastic presentation. I'm glad I already have a job. If this is what the next generation is bringing, oh my goodness gracious. This is fantastic. Thank you so much for organizing your thoughts, presenting it in like a logical manner. I feel like I understood it and I didn't have to reach too hard. Sorry, there are flies attacking my lunch right now. My question is around, what is it around? Did you consider, so what I'm seeing right now is like this idea of a pod, and it kind of is put into the community. Did you consider how to engage the community itself and kind of designing the pod, what it looks like, where it's placed, what happens to it after, the purpose changes, and that kind of longer time horizon, both, placement and then use afterward?
Yeah, so
Go ahead, Paulina.
Okay, very quickly, but just we at first had this idea of the care pod to be focused on COVID times, but essentially like this pod could benefit for the future years for any time, not just for COVID times, but it could work for mental health, like psychologists or like mental health meetings, regular consultations, very quick consultations. So we're not really focusing on like a certain time period, so COVID-19, but for the future years.
And the functionality of the care pod is based on the environment and location.
Okay, wonderful. Thank you both.
Thank you.
I think that a lot of us are kind of getting at a similar thought, which is that, having a healthcare service exist in a community that is accessible to the public, but doesn't have any human resources on site is extremely challenging. The architectural design, which is not my specialty, so I'm just in awe of anyone who can do that, including pretty much everyone on this call, is incredible. And one way of not having a staff member from this, the pod, be on site as the person operating this is to really engage leaders in the community. Schools, churches, barbershops are awesome, grocery stores, somebody who wants this to exist at their in their space. And I think that would be a really cool next step.
Thank you.
I had a question about people who are visually impaired. So a lot of the features, the colored glass, and even having the screen and interacting with a healthcare provider visually, how might you accommodate somebody who isn't able to see, or somebody who perhaps can only, in terms of their cognitive diversity, isn't really able to be in an enclosed space?
Right. As for users who need, voice assistance, like the pod, like the screen itself functions both with hand movements, touch, and voice, so by voice. And so the medical assistant there will help you guide yourself through the whole call from the start to the end. But yeah, in the sense of someone who can't really stay inside of a closed space, we haven't thought about that, but definitely think about it for a second iteration 2.0 of the care pod.
I love that you're thinking about 2.0 and second iteration. I want to echo a lot of the other judges. The presentation was really well done. very professional, very thorough. The renderings were really nice. It gave us a good sense of what the idea was. To me, if you could answer a couple of questions, it sounds like a lot of what you're tackling, and I admire that you're tackling the problem of access to healthcare. But it sounds like the pod does a great job of looking at the front end of it. So the consult and the diagnosis part. Could you tell us maybe what your idea is for the actual care part? How does the person then access medication, aftercare? Did you think about it as a system, or are you mostly focused on the front end of the problem?
So far, we're mostly focused on the front end of the problem, but we have touched on the whole like after process after using the care pod. If you have any medication, the care pod would, how do I say it, like prescribe it, and then you would go to the nearest pharmacy to pick it up. And if anything, the care pod would also provide and cover the cost of the medication.
The device in the care pod, anything we can do virtually on here, the care pod can do. So the patients would have to physically pick up the medication.
One thing that I think would be really cool to incorporate in this, that you guys already sort of have the structure for with everything that you described, would be to include community health workers in this process. So we think about, you know, needing doctors and nurses as part of what people need in healthcare, but a lot of times that's really not what is needed, or that's not everything that is needed. At the COVID testing and vaccine sites that I run, we include community health workers on site who also follow up with patients by phone, assess the needs of each individual patient, which I think could help with some of the, you know, variable needs of different members of the community, whether it's, you know, physical disabilities or need to access medication or financial issues or home issues. A lot of these are non-medical, but a consult with a community health worker, I think, would be an incredible thing to add to this process.
Thank you.
Thank you.
One more thing I'll say, if we have time, quickly, is these things don't necessarily have to be kind of fixed or like permanent, right? So a lot of times in architecture, we think of the architecture as this kind of like permanent thing that sort of stays the same forever. But oftentimes people tend to use buildings and objects in ways that the designer didn't intend, right? So I am wondering how these pods, I shouldn't refer to them as things, they're very sophisticated. These pods might sort of invite themselves to be hacked or dismantled or modified by the community, right? So it's not just the sort of fixed, sort of, again, like kind of packaged thing, pod, excuse me. Is it something that can change over time, and what does that look like? It was more so a rhetorical question, but I'd love to see a 2 or 3.0.
As for that question, our pods, like it's not specifically, how do I say, permanent in the location. It's rather more of like a pop-up. So it could change in, say, like in 6 months or like a year. And we also have this idea that after 6 months, they would replace all of the pods to maintain that sort of cleanliness and like for the, how do I say it? To make sure that it's like maintained in a good, you know, state, the pod.
Thank you so much to Paulina and Alexis. It's my pleasure now to welcome Allison.
Just set it up. Okay, if you can see that, then I think we are good. So this is my presentation on my project, The Pop Shop. Good afternoon. My name is Allison Casey, and I'm 14 years old. My pronouns are she, her, and I just finished 9th grade at La Jolla Country Day School in San Diego, California. Racial and socioeconomic disparities have been an issue forever, especially in medicine. And now with COVID, we are seeing this in a whole new light. One of the many examples out there was the death of the Black doctor Susan Moore back in December. She, among other African Americans, was more susceptible to the virus because they suffer from higher rates of obesity, diabetes, and asthma. These are all physical problems, but our society is no less to blame for her and other people of color's deaths due to COVID. They are disproportionately vulnerable because of systemic racism, inequity in healthcare access, and unequal economic opportunities. The Johns Hopkins School of Medicine stated, "The coronavirus pandemic has decimated communities of color, which are overrepresented in the front line, essential jobs, and vulnerable to risk factors that can make COVID-19 worse." This was in an article regarding the race gaps in COVID and COVID deaths and showed that for healthy Americans, the ratio of Black and Hispanic to white deaths was 10-1 and 8-1. Shown with data from the Kaiser Family Foundation here, you can see the inequality in 3 of the most notable spots in our country in vaccinations compared to people of color's shares of cases, deaths, and their total populations in that place. And so here is my solution. This is the Pop Shot. It is a state government-funded vaccine truck that brings COVID resources to people who need it instead of having them go and get it out themselves. It would partner with local communities in order to create a healthier world by vaccinating the people there, and specifically hesitant people and children now that we are moving towards a more everyone else is vaccinated type of situation. So now this is a user scenario story of how someone would use this program. So this is the family I'm using. This is James and Bonnie, and they live with their son, John, and their 13-year-old granddaughter, Ava, and 2 other children. And all 3 of the adults work multiple jobs to support their families, so they haven't had time in their schedules to get Ava vaccinated. And this is where my program would help. So to inform the local communities of upcoming Pop Shot, mail would be sent to the people there by the government, and they would be able to have flyers inside of them that have information about the upcoming Pop Shot inside of them. So this is a closer look. It will have English on one side and the most common language or languages on the other side. My program will be multilingual to ensure that everyone feels comfortable and understands, which is crucial for this to run smoothly. Then in the middle, it will have the dates and times it will be open. The pop-up will be open for at least a week and be open early in the mornings and late at night so that people that work have as much accessibility and don't have to take time that could be really valuable for their families off from their jobs. There will be also lots of local advertisements in the forms of billboards or in common places such as bus stops to make sure that everyone is informed about the pop-up in the local area. Word of mouth will also be a very helpful type of advertisement because many of these communities are close to each other and talk a lot. So here, Bonnie and James are talking with 2 other people in the neighborhood, Maria and Earl. So Maria doesn't speak great English, and so she didn't know how to get her vaccine. And Bonnie was able to give her the flyer that has all the information in the language that Maria speaks, so she can understand more and knows that she can go to the pop-up to get her vaccine. And as for Earl, he believes that the vaccine could hurt him, so he doesn't want to get it. And James couldn't convince him to get it just by talking to him, but he did get Earl to at least come check it out when he brings Ava to get her vaccine. So this is what the first section of the Pop Shot would look. This would be the administrative section where people would fill out their paperwork and they would wait before they get their vaccine. And here you can see Maria. She's ready to get her vaccine, but there is a line because it will be almost all walk-ups so that everyone gets a fair turn. And she doesn't want to wait too long. And luckily for her, she's able to fill out the paperwork ahead of time, like right now, and then just come back a little bit later and go straight to the front of the line so she can use her time more effectively. And so she decided she wanted to do that, so she's going to go home. And so the staff will be easily identifiable because they have to wear a badge with their information so the community can see their credentials and trust the staff because that is extremely important. Most of the staff will be made up of med and nursing students supervised by long-term doctors, nurse practitioners, and other nurses. Then there will also be administrative staff, which will be people from the local communities who can help build that community bond between the patients and the people at the Pop Shot. And this is the second part of the Pop Shot where the vaccinations would take place. Here's Ava with James and Earl, and she's about to get her shot. So there will be little sections, like little dividers and everything. So everyone is completely private from everyone else, and you don't have to watch everyone else get their shots. And she will have to come back for her second vaccine in a few weeks because she's not old enough for the Johnson & Johnson, which my truck would provide, because then you don't have to fit a second shot into their schedules. So there will be Johnson & Johnson and Pfizer because some people are more comfortable with the Pfizer vaccine and would be okay with coming back again. So I think it's just more a personal preference. But if you're a child, then obviously you have to get the Pfizer vaccine. And this is the last part. It's more fun. It's supposed to be very much more comfortable and not threatening to people. So this is where they would get their ice cream and just hang out there 15 minutes. And the community can just sort of hang out together, and it'll be much more of a relaxed situation. So here the people, they're just kind of hanging. There's fun seating, there's little fun games, and she can go and get her ice cream from the truck. So I came up with this idea for this project with my mom, and then I was able to draw from my grandmother's experience with her vaccine to see what important features my program could have that would have made her life easier. So she doesn't speak great English, so she struggles to understand the whole concept of COVID in general, and she doesn't know technology very well, so she couldn't even schedule her own vaccine. My mom had to schedule it for her. And then also something really hard for her was navigating a new location. So she actually had to bring friends with her to the super site so they could help her translate and know where she had to go because she couldn't do it herself. And she also lives really far, so none of my family members could help her out there. So these issues were very good for me to know because she's definitely not the only person with the same issues. So they were really important that they were addressed in my program. And she said that this would have benefited her because she knows the neighborhood well, she understands the language it would have been speaking in, and it would be much more simple all around for her. Now this is my extremely low-tech model. I was originally going to paint it and add my designs physically, but that did not work out for me. So I did it digitally, and it's far from perfect, but I think the basic idea is there, showing what it might look like in real life. And so I just started designing this in February when vaccines were not as open as they are today. So throughout the redesign months, my design had to change with the changing times, but it made me rethink a couple ideas in my design, and I think it has really grown since I first started it. These are my two original sketches, and so they are very much more simple. They're much more big picture than anything that I have now. So there's like this one has a website, it has a truck, it has a little station where you register and then you get your vaccine. It's very similar in my first submission sketch, but here is my actual final sketch right now, and it focuses a lot more on details, which I really liked doing. It had a lot more little nuanced ideas, and so like the music, the games, and like this billboard instead of just like a floating poster, it all connects a lot more. So I think it was a lot more detail oriented in my final design. And now, as we are approaching the post-COVID world fairly soon, I envision that other vaccines and vaccines for the like little kids who haven't been able to get their COVID vaccines yet would be the main use to my program. So my design can be used as like a mobile flu shot vaccine site that provides free shots and brings it all to them so they don't have to schedule it, go out of their way to get the flu shot, which is also good that they can educate people in the neighborhoods in order to get their vaccines and not be scared of it. And also a couple other vaccines that my truck could carry would be the tetanus shot, HPV shot, shingles vaccine, pneumonia vaccine, things like that that people often need but do not have very good access to. Thank you so much, and I am now open for any questions or feedback.
Thank you so much, Allison. A really great presentation. I love the way that you built out scenarios to show what would happen for the people who would benefit from this idea. And I wondered if you had thought about what potential public and private partnerships might be. For example, automotive or transportation companies may be getting involved, thinking about that back of house piece, not just the consumers and patients, but how would this actually work in terms of actually mobilizing and getting different partners involved?
So I think for like the doctors and the students and everyone that is running it, it would mostly be from like the med school universities who would partner with the local ones and local community clinics in order to get the doctors and nurses for that. And then also with the local companies, businesses for making partnerships with them so that they can also have it like we could do the pop-up in their facilities, like at a local church or something, because those will also help the community trust aspect of it.
You're actually describing an operation that is almost exactly what I do. So it's really cool to hear from your perspective, because you've hit a lot of really important points that I think go overlooked a lot in terms of language accessibility and outreach to people who are, nervous to get to sites, not only to get the vaccine, but also whether the site will be accessible to them, whether they'll speak the language, whether they can get the appointment, whether they can move through the site comfortably based on various different obstacles. So it was really cool to hear your presentation, and I wish I met you back in February, but it's happening now, and that's it's cool to see this. For a long time I was actually thinking about an ice cream truck as a really good option for the community, like mobile aspect, because you have a cooler, you can cool the vaccines. We actually worked with Ford to their innovation group, and they've rented us or leased us a couple of vehicles that are similar looking to ice cream trucks. They have refrigerators on the trucks and storage for everything that you might need. We're working with students and volunteers and interpreters. But my number one question was exactly what Sami just said, which is, how would you engage community partners? And I think that was my question for the prior group too. And such an important part of any of these programs being successful is, I think that I've personally been really happy to see so much interest from community groups in supporting these operations. And I think that having those connections in terms of outreach to bring people to the site, and also finding locations that are supportive of the operation, are really important. So I'd love to hear your thoughts on that too.
Sorry, just to clarify, was your question just like what partners I would use, or like?
Yeah, like how would you envision working together with community partners, both to set up a potential location for one of your sites and also to reach out into the community to let people know about this service?
So I think definitely places that people congregate a lot. So like once little kids are getting vaccinated, I think like local daycare centers and preschools and like YMCA centers, things like that. And just for everyone, churches are very common places, like religious temples, everything where people are at a lot, and that's very much a community space. So places like that. And then if we partnered with them, they would be able to also tell people in their communities that this will be happening, and would also be able to help them trust that no one's going to be hurt, and it's not going to like be anything bad that happens to them if they go out and go to the pop shop.
Hey, Allison.
Hi.
So I thought this is a fantastic project. I have a quick story for you, but before I do that, before I forget, I'm so happy that you're thinking about religious spaces as community spaces. I think often it's it's kind of even in design justice conversations, we tend to underestimate religious spaces as community spaces. So I appreciate that you're doing that. So thank you. You got chops. So my quick story is that when I was your age, I went to Art Center to apply for their Saturday High program, and I had a portfolio, and in this portfolio was a BMW advertisement that looked like a Beatles cover. And the person who was assessing as Kit Barron, I still remember, gave me a look that pretty much said, "What the heck are you doing?" Right? The BMW would never go for this, right? And why? It's because I was a designer, and I was putting what I wanted on the page without thinking about the customer, without thinking about the people who are buying BMWs, etc. Right? So I loved that you said that you were working with your mom and you're working with your grandma, right? And from that emerged this project, right? So you're getting what I never got at your age, which is that when you create things with people really closely, the designs that you make are radically different, right? I mean, they can land you in a national design competition as a finalist, right? So as you continue your practice, and even if you continue developing this, I would encourage you to just keep talking to people, right? Because the insights that you've delivered here are testament to that. I don't have to ask if you've been talking to people, because they're rooted in community. So I just wanted to, applaud you on that and encourage you to keep going that direction, because it's going to pay off. Already is paying off for you.
Yeah, Allison, I echo Josh. I really loved the story you told, where you looked at how it impacts an intergenerational audience, and you looked at it not just as the process of vaccination itself, but afterwards, where the community could hang out, and you're really using that ice cream truck as a way to reduce fear in people. And that's probably one of the biggest challenges, I think, with the vaccine, is there's a lot of fear around what will it be like, what it'll be like after. And so you tackled a really complex problem there. I just wonder about opportunities for education as well, because it seemed like part of your solution was education was more of a printed pamphlet, but the rest of your solution is so interactive and so conversational. I wonder if you could think about that education piece also taking on the more conversational, community-based approach. So that's, if you have thoughts, great, but that would be my suggestion for you as you continue to evolve this.
Okay. Yeah, I didn't really reference it that much, but I kind of assumed it would mostly be, since it is like licensed professionals, I think they might be able to help explain it to people. There would be information out there that they could help like visually explain how this isn't going to hurt them. The side effects are this, this, and this. It's not going to like microchip you, So just having those people that they can trust, telling them there's nothing wrong with it, it is completely safe to get, would be an education point, I think.
Allison, I just appreciate the really, really, really cool proposal. I love that you're thinking about not necessarily just the point of contact, the point of access, but you're also kind of thinking and really inviting a kind of milieu of things to happen around the point of access, which I think is so fascinating. And I'm looking at your drawings, your vignettes, and I can imagine myself being there, which I think is really cool. I actually grew up in rural Virginia. It's a small town actually called Farmville. And so one of my memories growing up was the Swan truck, SCHWANN, I think. It's like a food vendor. They also would sell like ice cream. And so like, there wasn't like the sort of suburban/urban experience of hearing the like ice cream truck jingle around the corner is not really a thing that I grew up with. There was a subscription-based service where like people would actually, order frozen foods. And so I could see this sort of format being really successful in less dense areas. That being said, I wonder what other services, right? Like thinking of it not necessarily as just a mobile vaccine truck, is this just a format of deploying resources, right, to less dense communities? So to Ruki's point, like can this be a mobile library? Like, can this also be a means of addressing food insecurity, right? I think that there's a whole sort of, I think you could widen the scope of your project, right? And so maybe it would be interesting to see what else can kind of become, what could come of that exercise.
Mhm. Yeah, I hadn't really thought about, sorry, I hadn't really thought about what it would be besides like health-based, but I was thinking like, especially for rural spots that don't have like a close clinic or anything, being able to do checkups and give people other health resources like just for wellness, like having Advil and other like over-the-counter meds so they don't have to go really far just to get them when we have them really close by. And also like contraceptives or anything like Narcan, just things that a lot of people don't have access to that could help people if they need it. But I hadn't really thought about the other aspects, and I think those are really cool ideas.
Yeah, I think it really just boils down to continuing to like interrogate and widen how you're thinking about health, right? So maybe it's not just the sort of purely commercial approach to health, but like, what good is a vaccine or what good is Advil if I'm starving to death, right? So like, I think thinking about all of those ways that health can be addressed would be using your truck as a format would be really fascinating.
Yeah, I really like that. Thank you.
Curry, that's a great point. And I could imagine the truck being a kind of a nexus of a lot of different community activities. So you could have a farmer's market that would show up or other types of services because there are so many intersecting issues when it comes to health. And also chronic diseases, as well as other infectious diseases beyond COVID, have suffered during the pandemic. And so how might we help to build back compliance and engagement with other issues so that we can make communities more healthy?
Yeah, I think people like my mom is a chronic illness psychologist, so she works with people like that. So I don't really know too much about the issue, but they've definitely had it harder hit for them because it's really hard for them to get their medications, to connect with people, see their family members. So I think just having the ability to get some human connections, even if it's through like this trek or something, and being able to get a little bit of health information from this trek, I think could be really a positive thing for them to have.
I think it's interesting to think about both the incentives and how to create joy and comfort in the space by giving out ice cream or pops, but also to think about other services that you can give or other services that you can help connect these patients to at these sites that patients need, not just things that make them, happier to get the vaccine. And I think, for example, at our sites, we've had sites where we gave out free tacos. We're going to be giving out free Phillies tickets next week. So things that make people excited to get the vaccine, that make them feel that they're at a service that is created for them to make them happy. But also we give out grocery bags, and we do, like I was saying before, community health workers are super helpful in any of these operations to assess patients on an individual basis and think about what they actually need, connecting them with, helping them keep their utilities on in their house, helping them pay their rent, get on unemployment, connecting with other services that exist in the community. And then from a bigger perspective, I think connecting with local food banks and connecting with local community organizations. A lot of times when we think about doing these pop-up events in the community, whether it's a COVID vaccine clinic or other health screening or something non-related to health or food distribution, it's really helpful to work together because we're both thinking about the same community, same patients that need our help, and thinking about getting them what they need. So it's been really helpful to work together with other community groups like that.
Yeah, listen, I wanted to offer one more thing before we take off. So, I mean, I wonder, as you continue, I would love also to see, what does it mean for you as you are right now to invite yourself to the table on this design project? What as someone, in your specific location, at your specific age, with your specific lived experience, right? What does that mean for what you include in this design? I think so often designers strive, and the act of striving means that you're going as broadly as you can and trying to create a universal, quote unquote, solution. And what often happens is that it falls short, right? And I can understand if you're if you're a larger entity like Johnson & Johnson, for example, you have no choice but to think of very broadly. But as an individual designer, right, what you can do is bring in your lived experience, right? So just like you talk to your mom and your grandma, and you're talking about your mom also having experience with folks with chronic illnesses, what would it mean for you to really invite yourself to the table on this design and include all of your lived experience in your consideration? Because you're a key stakeholder in this, right? So anyways, really nice job. I just want more, Allison.
I just had one last thought as well, which is that if you're taking this health delivery system into communities, how might you also contribute to employment opportunities? And so thinking about how to upskill local community members and even students who might consider community health as a career possibility. So there could be an interesting way to also engage with the community to deliver what the mobile vans can deliver.
Yeah, I was thinking that the administrative people and like the other people on site that aren't just the healthcare workers would definitely be people from the local communities. So it increases and helps the local economies. And definitely if we're partnering with a local like bakery or like something like that, where then they could hire more people to help them for a little bit, and we could definitely help reimburse that so that they're not losing any money from that either.
Thank you so much, Allison. It's now my pleasure to welcome Aditi, Nidhi, and Yasmina.
Hi. How many of you are in perfect health? Well, we're Egel, named after the Greek goddess of radiant good health, here to help everyone achieve that goal. I'm Yasmina, a rising senior from Greenville, Kentucky, and my pronouns are she, her.
I'm Aditi, a rising senior from Louisville, Kentucky, and my pronouns are she, they.
I'm Nidhi, rising senior from Austin, Texas, and my pronouns are she, her.
People very often overlook their personal health, especially mental health. Despite only being teenagers, we've seen plenty of people doing so, neglecting it, physical and mental, whether they're adults or our peers. We've gone through our own struggle over the years with various issues, varying from addiction to periods of general neglect. Yet even when in the pits of health and exhaustion, we and the people we know have always tried to reach out and help others, despite any distance or time. Empathy can overcome any struggle, yet people rarely apply it towards themselves. We molded this into our purpose in the problem that we start to tackle, which can be divided into 4 components. People often struggle with the basic tasks of self-care for various reasons. They end up accidentally neglecting themselves and or struggle with various addictions. Yet most of them have no problem caring for others. Any combination of this is detrimental to a person's health and an obstacle we aim to address.
To focus on the component of addiction for a moment, the journey to recovery begins with recognition, the hardest step, but one that a person needs to make on their own. After recognizing the problem, a person requires solutions, coping mechanisms, support systems, and tools. This is where we come in. Finally, the journey ends and a person comes out happier and healthier.
Our idea began with a plant that a user can project their empathy upon and take care of by taking care of themselves. We later broadened it to incorporate healing from addictions and celebrating progress as a community.
The inspiration came from observing our communities. So to broaden our understanding, we gathered data to figure out our audience. By surveying over 400 people from around the world, most of whom are located in the United States or India, we discovered that our product would connect with many adolescents and middle-aged adults, over 3/4 of whom said our physical reminder of their health would be helpful, and that it's easier for others to care for themselves, to care for others rather than themselves.
We tied this all together to create our solution, Egel, named after the Greek goddess of radiant good health. We plan to partner with organizations like Alcoholics Anonymous, and ideally it will be funded by insurance companies in an effort to decrease addiction-related deaths. AGLE consists of 2 parts, the first of which is an app containing a log to track daily health and set goals, a journal with prompts to encourage positive thinking and progress, highly customizable settings and privacy features, and a chat to connect with the community of similarly struggling individuals. The second part is a mechanical individualized plant that mimics the mood-based motions of the digital plant and can be placed in sight as a physical, empathy-focused reminder of the user's health that encourages improvement.
In addition, the app has a butterfly feature to aid with addiction and general bad habits. The user receives butterflies for reaching customizable milestones, and once they get the amount that they desire, the user can send their butterflies to a communal garden to celebrate the collective progress of the AGLE community and to encourage one another. Or, for more of a personalized form of encouragement, the user can take their butterflies out of the app and into the real world with the augmented reality camera. After identifying the problem and exploring the solution, we designed the prototype.
Throughout our journey in creating the model we're about to present, we changed a lot from brainstorming problems and solutions to the original idea of a plant which plays off of people's empathy to extend it towards themselves, taking inspiration from our own group chat, where even across the country, we check up on each other's self-care habits such as sleep and meals. We drafted multiple wireframes and then created a user journey. Throughout the process, we edited the screen design, scrapped a talking mechanical plant with a face, because honestly, it was a little creepy. We added an emphasis on community features, expanded on the butterfly feature, and did anything possible to create a more welcoming environment for growth. We finalized the product to arrive at this story. Anna has been using AGLE for quite some time. She receives encouraging reminders from her roads whenever she opens the app. She customized it this way so that some of her friends wouldn't see a notification and question it, because she's not ready to ask for their support quite yet. She loved how much AGLE valued and ensured her privacy and comfort. Her plant is still happy from yesterday, and her butterflies make her smile. Look at that wonderful progress. She goes to fill out her log as she reflects on the day. The goal she set last night was accomplished. Her eating disorder made the progress slow and steps small, but they were steps nonetheless. Her meal, water, and sleep numbers made her realize just how tired she was. So she got out of bed and drank a glass of water. How did she forget to drink water all day? Maybe because she was so focused on not drinking alcohol. There, that's better. She decides to aim a little higher for tomorrow's goal. Anna then goes to the journal and fills out the prompts. The last question is her favorite. It's always so nice to focus on the positive. When she switches back to check on her rows, her heart aches a bit to see it wilt, no matter how slightly. She glances up to her desk just in time to see the change. Ah well, tomorrow would be better. When she turns back to the app, the simulated sun has set as well. She goes to her community to check on her fellow companions and is very happy to see her friend, Fabio Marcelli, doing better. It's wonderful when people that share your struggle do well, even when you're not. She considers checking in on her other community, but since it's been a good couple of days for that addiction, she moves on to check on the butterfly garden. This is her favorite part of the app, so she always congratulates a couple users before going to sleep. She's always excited to wake up to a "Congratulations" notification from another user, so she wants to gift that to others. The next day, she texts Ebony, a friend she called yesterday, and they decide to go on a walk together. She can't believe the progress she's made since starting AGLE. The daily reflections and encouragement keep her motivation high when she wants to fall back into her old habits of starvation and isolation. Calling a friend is more than she could have imagined weeks ago, and look at her now. On their walk, Anna decides to show Ebony her butterflies in the augmented reality camera. As they watch them settle on benches and branches, she suggests Ebony get the app as well for their caffeine addiction. It helped her, why not others?
Ebony agrees. They get the app and start reading the introduction. Reading could help sounds pretty good, so they sign up with their email and password. They decide to set their goal at 2 meals, 3 cups of water, and 6 hours of sleep. A little low, but everyone starts somewhere. Ebony's been struggling with a coffee addiction for several years and has gotten horrible headaches and pains because of it. It was about time to take a step and make a change for the better. With all the flower options, they feel a bit overwhelmed, so they settle for the default option of azaleas. If they like the app, maybe they'll customize it later. Since they don't have a physical flower, they skip the code portion and set their milestone to every week. A fairly decent starting point. Anna assures them they can adjust later if need be. When the screen loads, they open settings. Time to start exploring AGLE. The story of Anna and Ebony is one that someone could hear about 2 people from any city in the world. But we want to ensure that our product can reach anyone, anywhere, no matter what resources are available to them.
Here, we'll cover 3 common difficulties a user could have. If a user doesn't have a mobile device, Eagle will be available as a website with reminders sent via email. No Wi-Fi, no problem. Eagle will be available in a condensed version as a mechanical plant with buttons to log progress and a notebook to set goals and journal thoughts. Not in a position to buy a physical plant? The app's free and can be used on its own, or the plant will be covered through insurance. For those with disabilities, such as blindness or with low vision, or those who require a different language, we have accessibility modifications, such as translations and text-to-speak options. Eagle aims to reach everyone who needs us and impact their life by making it a happier one lived with radiant good health.
We sent our model out to several members of our communities and incorporated their feedback and quotes, which you can see here. They believe our design will have a positive impact on the health and lifestyle of a person using the program due to the customizability, constant reflection, and the encouraging community that the app provides.
We understand that our app is one of hundreds that's in the market trying to help people improve their health, several of which we or someone we know have used. Many are good apps, but most are specialized for one addiction with little customizability, have expensive premium options, and an app on its own is easy to lose track of within the many a person uses in a day, despite any notifications or pop-ups it provides. A physical object that can be placed in sight reminds the user that their health is much more valuable than an app on its own, especially when there's a consequence to neglecting the app and when it covers not just addiction, but general health as well. Personal connections are a good option as well, one that our app offers the additional benefit of optional anonymous features and accessibility.
So, in conclusion, the obstacles of inadequate self-care and addiction can be overcome by consistent reflection, specialized features, a community of encouraging groups, and a growth mindset. Our product aims to provide this to any individual in need of aid and help them achieve radiant good health, impacting anyone and everyone who reaches out by helping them with their personal journey. Everyone struggles, but let's grow together with Eagle. Thank you all for your time. We are now open to questions.
Thank you very much for the presentation. It's a really fascinating idea of the physical and the digital complementing one another. I just had a question about the journey of somebody who is working through addiction. And you showed it as a linear journey, but honestly, I think that there's often setbacks and relapses and the circularity of it. How have you thought through how you might help somebody who might get discouraged along the way?
While we did show it in the linear journey, we completely understand that often progress isn't a linear thing. Everyone has a different journey to what they consider to be recovery. We wanted to make this customizable in the way through our features in our app. As you may have seen during the Figma model, users can set their goals each day to day. So once your goal is complete for that day, when you're filling out the log at night, you set your goal for tomorrow. If you feel slightly discouraged, like you're not doing nearly as well as you were perhaps yesterday, you can set your goal a little bit lower and it won't suffer consequences. We do encourage our users to respect all of their progress and all of their ups and downs as well.
I can comment quickly. Hey, so nice presentation. I do really I was like, well, that makes sense, because usually I'm not the one who's thinking about my self-care. It's my partner or someone around me who's thinking about, for example, like my partner just brought me water because it's hot out here. So I love this idea of like empathy and kind of exporting self-care to this kind of collective model. I think that's clever. And I think that the tools available to us now could make that actually work. So I like that idea. What I started to get held up on just a little bit is kind of and again, this is just what I'm gathering, so I'd love for you to provide a response if you can, but almost like this connection between health and happiness that I think is really complicated. As if when we achieve perfect health, quote unquote, we'll be happy and well. I don't think that's necessarily the case. So I maybe would invite a more expansive look at it, moving away from health as kind of defined medically to wellness as maybe defined communally. And then I'm thinking about if we shift from health to wellness, what I thought was, again, kind of missing a little bit in the criteria was the social factors and the political factors that often lead to things like addiction or poor health, right? I mean, where's the space for a food desert showing up in one's inability to get, eat the rainbow, as they say, or someone living in an economic desert similarly, who couldn't afford organic produce, right? Or who might be more inclined to get diabetes just because of where they're geographically located, or be more addicted because they live in a place that, anyways, we can go down that road, but Michelle Alexander has much to say about that. So I would love to kind of think about, I would love to hear from you, like how, if at all, you were thinking about how to kind of include these kind of social and political factors that lead into health and health outcomes. And then also if you find it maybe appropriate at all to kind of expand the notion of health to maybe a broader sense of wellness.
To answer the first part of the tie between happiness and health, the two are connected, although it's much more complicated than what we went into a 10-minute presentation.
Sure.
If a person is unhealthy, it's generally more difficult for them to be happy. This is not to say that they're constantly happy, because a healthy person has to have their ups and downs. However, an unhealthy person is one who struggles to maybe get up. So that is where we're making the tie, wherein a happier person is generally a healthier person, because the tie exists there. It's just more complicated than we could cover.
Yes, and we did want to incorporate acknowledging your happiness, even with your ups and downs, through our journal feature. I think Anna, in her story, we mentioned that one of her favorite questions in the journal is the last one. We always want to recognize the positive aspect of the journey itself, and we want to do that through some of our more subjective features, I guess. And then as for the community interactions, hopefully with trying to address the social political climates of people in their individual situations, we were hoping to do that through perhaps a 2.0 version. It's in the thinking process, but we did get the idea that we could have a local sort of feature along with the butterfly garden, that you could connect with others in your local community, as well as the broad community of your addiction, or just general community as shown on Able. Along with the fact that we want to partner with organizations like Alcoholics Anonymous. A lot of those personal human connections would come from places like that. So even beyond the app, we want to encourage all of that human connection we were discussing.
And as for, as for availability of people's resources, that is not something that a simple app could solve. Tons of components go into creating that sort of environment. But even within that environment, there's always room to grow and live better. And that's what we aim to achieve.
Thank you so much.
I wanted to build on what Josh was saying just for a moment, which is that there's maybe an extra degree of personalization that might be possible. So every individual might define happiness differently. And so rather than to feel almost intimidated by not living up to what you feel society expects when it comes to happiness, having that empowerment to say, well, for me, these are my priorities. This is what I'm going to be setting as my goals. And then maybe even to the experience of it, perhaps someone might want another creature, thinking of the positive benefit of biophilia. And I like the idea of nature and the plant and nurturing. But maybe individuals might have a different aesthetic as to what they would want. Maybe they want bats instead of butterflies, or just thinking about what is the customization potential for even helping people not feel like it's all or nothing when it comes to succeeding with their health and happiness.
Yes, we fully appreciate your insight on that. We tried to incorporate a similar ideology in our creation of a few of our customization features, like the journal. Like I mentioned earlier, we do try to focus a lot on individual happiness, how you define your life to be. We really want the user to be able to take the reins of their own life there. And along with the customizable goal setting, all of that echoes exactly the insight you were providing. And then as for the customizability features, that would be lovely actually for the aesthetics. We did try to incorporate that with the multiple plants option, so you could choose different types of plants. But with the different aesthetics, we could absolutely consider that in a 2.0 version. Thank you for your feedback.
I was thinking the same thing. I actually would like a puppy on my version of the app, if you could create that. I love how you guys, I love your presentation, very well done. And I love the innovation. I think it's really cool how you're reimagining a really important concept in design of empathy and how we can use it to improve self-care. I think that's really cool, really innovative. I also think, you know, as Josh was saying, that it's complicated, you know, the struggle with addiction and the sort of non-linear path that people go on. People are very hard on themselves when they relapse. People are very, people don't typically feel overly happy that they spent one more day that they didn't use something, but if they do use it on that same day, they will be really hard on themselves. So I think it's a cool feedback, sort of a way to track your health and the journey of recovery, to be showing it in this kind of way. But I do think that it'd be really interesting to, you know, think about those really difficult moments that people deal with, whether it's, you know, they're in an abusive relationship or they can't get access to food or they lost their job, and some of the specific things that people might bring up as reasons that they are having a hard time, or, you know, maybe they don't have a place to stay because their family member kicked them out. I mean, these are just maybe a few of the things people have recently told me in the emergency room as reasons that they've relapsed. I think that it would be cool if we are getting a lot of engagement in these apps to have that moment be an opportunity to direct patients to the resources that might help them. Have you guys thought about that?
Well, first I wanted to say that we do realize that addiction is a surface level condition, that there's usually so many factors underneath that contribute to that, whether it's a deeper mental health issue or an outside issue, as you've mentioned, an abusive relationship, very common. So we do want to offer help. So I don't know if you saw it in the Figma model, we went through that a little faster, but in the settings, there was a get support button where we could have landlines there and separate phone numbers. There's a couple resources that are available in a mobile kind of way, like texting 741-741. That's one that is very commonly used because you don't have to have the discomfort of a call. It's just texting, but there's a professional on the line. So we do want to offer those resources. And that is definitely something that we would look further into in a further version. As of now, this is more for a user who is bettering themselves in their own environment. It could very well be used alongside with a therapist, or you could connect with someone in the chat. So we do want to cover that. We covered it a little bit, but we do want to cover it more in the 2.0.
Yes.
I think it makes sense to, you know, with apps, like a lot of people want to design apps, and apps are all over the place. And a lot of the mistakes people make early on is to try to make the app do everything. And so I think that's smart in some ways to really focus on the main point that you're trying to get across and not try to add too many things right away. But thank you for your answer.
Thank you for your kind words and feedback.
It's a great point, Morgan. Throughout your presentation, which was really enjoyable to watch and learn from, actually. I was reminded of this book. I can't remember the author. It's called Heat Wave: A Social Autopsy of something. It was about the heat wave in Chicago, and how like hundreds of people died from an extensive like heat wave, and the author sort of investigated the demographics of the folks that passed away during this heat wave, and tried to unpack some patterns, and there were some, yeah, that's right, Klinenberg. and there were some trends that they could sort of try to predict as far as who they thought maybe should have died based on their socioeconomic condition, that were completely sort of refuted by the actual results, right? So at the end of the day, it became apparent that a lack of social infrastructure, right? A lack of sort of communal relationships were ultimately the driving factor for the people that were the demographics that had the higher rates of death. So like the Latin communities had much lower rates of death. Elderly men had higher rates of death because they tend to not foster those relationships later in life, whereas elderly women tend to, apparently. So I'm just thinking about your app and like how it has the potential to kind of foster these kinds of relationships. And I just think that was really delightful. On the other hand, though, I'm thinking about like these more analog IRL kind of relationships that could be fostered through this sort of format of care, or framework of care that you all are setting up. I'm not sure what that looks like. I'm just kind of putting that out there. That is it. To Morgan's point, is it the app exclusively? Is there an app plus kind of model, right? Are there other amenities that that you can kind of engage that can really speak directly to the app and how it operates?
While we do, of course, want to focus on that important human aspect, our app itself doesn't focus on the real personal human connection with local communities, but we do want to do that through our partnerships. I think we mentioned with organizations like Alcoholics Anonymous, those communities often foster those really personal relationships, and through partnership with them, we would absolutely love to create those kind of things. Though like Ms. Morgan mentioned, sometimes our app won't be able to do everything adequately, and it really is best to leave that to our partners, and we're delighted to have them. Does that answer your question?
Yeah, absolutely. Yeah, it was more rhetorical than anything else, but yeah.
Apologies, sure. But thank you for your feedback.
No, you're fine. No, I love what you all are putting on the table.
And then I think Aditi mentioned it a little previously in the Q&A. We were thinking of discussing a location aspect. This was mentioned in one of our previous mentor weekends. That would be a little more difficult to implement due to us wanting to protect people's privacy. However, that could be very useful if you were looking for someone within your area to spend some one-on-one time with in real life and foster that connection. You are absolutely right. That is a crucial aspect of just generally just being a human.
I had one consideration as well, which is that many individuals are not just dealing with one issue. So how might this app and platform help support somebody who needs to make choices? So we once did research and we're speaking with a person who had a mental health issue as well as diabetes. And she actually prioritized mental health because she felt that that was more important to her being able to function well. And some of the tactics that helped her with mental health actually went against the diabetes, because it included meetups that often had food that wasn't necessarily supportive of her condition. So that might be something in the future where you might be able to map multiple conditions and help individuals prioritize, because that's something that will evolve over time.
So we actually, in Figma, we covered it. Anna, she has an alcohol addiction and an eating addiction. Not eating addiction. She has an eating problem. So when we covered it, she has 2 communities available, one to help her with each addiction or problem that she's going through at the current moment. So we do have the option for multiple addictions or multiple problems that a user could have.
Yes, but we do fully understand that sometimes those things contradict each other, like with the example you gave. That would definitely be something to consider in future iterations. Thank you for that.
I want to congratulate your team for just how you've tackled a very complex topic head on, and you've thought about it from many different angles. I appreciate the balance between a very high-tech solution versus also you talked about one where if you don't have access to technology, how it could function. I appreciate you thought about that. You also thought about a balance between needing to be more private at times and needing a community at times. And so you thought about multiple things. Could you talk a little bit more about the interface itself and what are those design decisions you made? How did you come up with those? Could you also talk about how would your customer hear about this beyond partnership? So if they didn't go to Alcoholics Anonymous or any of those groups, how would they hear about this type of solution?
I can cover the second part of that question, and I believe one of my partners are better suited for the first part. They're amazing with design, by the way, can I just say? But we mentioned that we plan to be funded by insurance because insurance would be motivated to decrease addiction-related deaths, as that is very costly for them. So the insurance could put out pamphlets, could advertise to their consumers that our app is a thing, that it could help them. Also word of mouth, as we showed in the story. A friend talked to a friend who can talk to a friend. That is a very powerful thing. We also mentioned the app I Am Sober. I have actually personally heard of it multiple times through several word of mouth methods through a couple friends. I've seen it on Reddit. I've seen it on Snapchat. Just people talking to people and reaching out to help is a very powerful tool. And again, insurance companies advertising is also something that we've considered. And then as for design.
Yes, I can do design for a bit. Our design has basically 5 components: our flower, which is the home base, the journal and log, community aspect of it, and then the butterfly garden AI, and then there's settings. So for journal and log, which was, we wanted to emphasize not just like the addiction that you're dealing with, but also your overall general health, which is why we had the food, food, how many meals are you having per day, how many water you're drinking, and how much sleep are you getting. And then another thing that we considered for the journal and log was that if we wanted to have like a goal that we put out, or just like the user want to pick their own goal. And we decided the user should pick their own goal because, again, addiction is not just a linear pathway, which we covered in the starting, and they should be able to pick on what they want to have as their goal, where they are, how they're feeling at the moment. For the community, a lot of communities in many different apps, they actually look very similar to ours. It's a pretty simple just user, and you can comment. We didn't want to have like Instagram and other social medias, they have a like concept of it. We didn't want to have that just because it creates a very social media, very competitive kind of thing, even if only the user sees how many likes you are getting. The butterfly garden was something that we added on after we sent in the first initial design. And the butterfly garden, we just wanted a reward, kind of a reward system, but also a community system where you can see there's a visual, there's other people out here. Like they might not be on the same fight but they're also fighting and they're also there. The AI part, we actually got the idea from Mentor Weekend. Like, so you're like sitting at a park and you just relaxed, and then you can just have butterflies flying around you. It's just a little happiness kind of thing.
Thank you.
Yeah.
I'm sort of going back and forth on how much I want to push this, but so for any app or for any sort of interface where you're collecting information about a patient, there's always going to be the question of like, how are you monitoring it? How you're responding to it? Patients might write things in there that are things that would otherwise, if they told their therapist, need to be responded to in an emergent sort of way. The main things that we think about are, plan to kill yourself, plan to kill someone else, plan to hurt a child. And so then there's the other thoughts that may not be as, have as like straightforward of a response pathway, like aggressive conversations on like an interactive platform, or inappropriate things that one person might say to another in front of others on that kind of platform. But especially using insurance to fund this, that would overcomplicate the issue of how to deal with that kind of information. And so I wonder if you guys have thought about this, or if you've learned about it through researching other apps that exist, how you would handle that situation.
we've thought about the chat aspect where making sure that people don't discourage one another instead. So we've considered having flag words like kill, or like a lot of social media apps have that as well. Make sure that the content is kept friendly. So that could be one option. Having actual people look over it, because this is such a delicate thing. Having real people go through the comments, that might be a bit more of a project, but it could be a surefire way to ensure that nothing is on there that shouldn't be. As for the journal, you bring up very good points that I don't believe we fully discussed, but a similar operation could be beneficial. And there's a thin line between someone contemplating it and planning, and then also just being in a heated moment and mentioning something. That would have to be something that the user would have to be aware of, that, hey, watch your language here. But that could also discourage them from being honest. So you're absolutely right. It is a very thin line that we have not fully discussed, but you give us very good things to think about. And we actually have not thought about the insurance part, but we don't. Insurance is corporate, which complicates things as well. But we do believe that that would be the best option for funding, as opposed to perhaps government funding, because they would have the best intentions, if you will. But yeah.
If I may add on, yes, for the insurance companies funding that, we could in fact restrict it so the guidelines aren't as complicated, perhaps to cases they deem safe in a way. And if not, we will be receiving revenue from selling the physical plans. Our price point is fairly low to make it affordable, but receiving revenue nonetheless, which could be used to further design advancements like Yasmina just discussed, as well as the fact that you mentioned, okay, if someone's planning something bad in their journal or log of the sort, then aside from the fact that the journal entries are fairly short, you can only fit about 2 sentences in there, not enough to make a detailed plan or anything incredibly negative. We also try to give consistent positive reminders. It is difficult to speak of those things, I guess, or put those things into the journal if you're in a constantly positive space. You have this constant encouragement. If someone were to do those sort of things, it likely wouldn't be in the journal, simply because it wouldn't allow for it logistically. As well as Yasmina mentioned some buzzwords that we could simply just give a small warning, like, hey, you're using a little bit of harsh language here. Are you sure you want to add this, or do you mean something else? And then, of course, things like the journal would be kept private. And as always, we encourage all of our users to reach out if they're able with partner organizations and therapy if you have access to it. Not everyone does, but wherever you have access outside of the app, it's also important. We do encourage our users to go to other sources if they're able. But yes, we thank you for those points. It's good for us to think about.
Thank you.
In the future, there might be the possibility of having pattern recognition, where using your voice or changes in your behavior or your interactions, that there could be flags that would alert even yourself that, it seems that you're shifting in how you're feeling about something, and just using the technology to identify some of those signals in terms of behavioral changes that might be minute and triggered by a voice or tonality.
Absolutely. That would be, oh, I'm sorry.
No, go ahead.
Right. That would absolutely be something to consider if we are able to do anything of the sort, considering privacy features, as we discussed. And as Ms. Morgan mentioned, it is fairly sensitive information. So if we're able to make any adequate guidelines, restrictions, so their information is safe, that would definitely be something to consider. Thank you.
I think also if you do consider like building out AI into the app, it might be, I think it's really important also to kind of look at bias in AI, especially when it comes to things like words that are used, right? What databases is it trained on? Because you can easily discriminate or get things out of context if it's not trained on a diverse set of data with kind of different uses of even English, you know. And also specifically around like mannerisms and how someone shows up, right, on a screen. So for example, you know, if I had something like Parkinson's, right, and the AI is trained on a database that thinks that, you know, my moving around means that I'm aggravated or anxious, and then flags it as a health issue when it's really just a fact of my body, you know, that's an issue. And it's, sorry, there's a plane. That's kind of an issue of inclusivity and justice, right? So as long as when you introduce systems like that, it's just an opportunity, an invitation to look at, you know, what is the machine deeming as right and wrong? How is it making those decisions? And is the root of that decision equitable and inclusive? Most of the times it's not, which is a really good opportunity for you as designers to expand what those tools do.
Absolutely. Thank you. That is incredibly valuable. I myself have done like minor research into the biases in AI, and you're completely correct. Oftentimes it doesn't consider the perspective of minorities, other groups, honestly, anything from what it deems normal, which is, as you said, often biased. So I think we actually did discuss having a lot of these features that would require AI, and we ultimately scrapped them simply because we wouldn't be able to ensure privacy or accuracy, like you mentioned. And we completely agree with your insight.
Wonderful.
Thanks.
Thank you, Aditi, Nidhi, and Yasmina. I'd love to welcome back all of our finalists to turn their videos back on. If you're able to. Wonderful. And I'll invite our judges now to unmute and join me in giving a huge round of applause to all of our finalists once again. You guys did a remarkable job presenting, and I know our judges have a very tough decision to make. We'll take a short break now, and when we return, our judges will announce the winner of the 2021 National High School Design Competition.
The NYC primary election will take place Tuesday, June 22nd. Early voting will be available June 12th to 20th, allowing you to vote whenever it's convenient for you. This primary election features ranked choice voting, which means you can now rank up to 5 candidates for mayor, public advocate, controller, borough president, and city council. Find your early voting poll site and learn more about ranked choice voting at findmypollsite.vote.nyc.
This is your new home speaking. I know you haven't moved in yet, but I need some favors. Could you dust the blinds? The dust makes me feel dusty. Also, we could save a lot of money if you bundled your home and car insurance with Geico. It's super easy to do online or over the phone. Last favor, when you move in, could you stick to one aesthetic? The last owner had a weird mix of floral wallpaper and nautical tchotchkes, and I can't have another identity crisis.
Geico. For bundling made easy, go to geico.com today.
Sky Vodka is now made with water enriched by Pacific minerals and filtered through California limestone. Sky Vodka, a smoother, fresher tasting vodka that's also gluten-free. Just in case you've ever wondered what a subtle ocean breeze tastes like. Sky Vodka, born from the blue. Sky Vodka distilled from grain, 40% alcohol by volume. 2021 Campari America, New York, New York. Please enjoy responsibly.
Nothing sounds quite like a dad's day at Lowe's. Like the DeWalt 20-volt max brushless drill and driver kit for $99. And the Craftsman 3000 PSI gas pressure washer, now $289. Give him the day he really wants. This Father's Day, let Dad loose at Lowe's. Home to any budget, home to any possibility. While supplies last, DeWalt drill kit offer valid 6/10 through 8/4. Craftsman gas pressure washer offer valid 6/10 through 6/23. U.S. only.
Don't spend more than you have to on your mobile service. Spectrum Mobile could save you up to 40% versus what you're paying now. Click to learn more. Spectrum delivers the fastest overall speeds and has the most reliable mobile service, coast to coast, with no hidden taxes, fees, or contracts. Plus, we let you mix, match, and switch between plans as often as you like, without penalty or fee. And nationwide 5G is included in every plan. Spectrum Mobile.
Kids discover the world through play. With Lego Duplo, our big bricks open a world of possibilities for preschoolers that is endless, diverse, and fun. Our themes, characters, and colorful bricks help toddlers build a strong foundation in social and emotional skills that will set them up for success in life. We like to say start off big. Building with Lego Duplo helps to nurture resilience, self-expression, and confidence. There's no right or wrong way to build, and kids gain a sense of accomplishment. But to them, they're just having lots of fun. Start off big with Lego Duplo. Tap the banner to learn more.
To show you how easy it is to file a claim with Geico, we hired singer-songwriter Lisa Loeb.
You say I got a crack on my windshield.
Lisa, maybe a little less heartbroken? Geico lets you file a claim online, over the phone, or with their app.
That makes me want to say, stay.
Ugh, nailed it. Geico, great service without all the drama. Spilled your drink? Bounty picks up spills quicker, and each sheet is 2 times more absorbent so you can use less than the leading value brand. Bounty, the quicker picker-upper.
Don't spend more than you have to on your mobile service. Spectrum Mobile could save you up to 40% versus what you're paying now. Click to learn more. Spectrum delivers the fastest overall speeds and has the most reliable mobile service, coast to coast, with no hidden taxes, fees, or contracts. Plus, we let you mix, match, and switch between plans as often as you like, without penalty or fee. And nationwide 5G is included in every plan. Spectrum Mobile.
Geico presents Motorcycle Word of the Day. Today's word is gremlin. Is a gremlin an unknown and persistent mechanical issue? Or is it something large that gets caught in your teeth when you ride with your mouth open? As in,
man, I gotta stop singing 80s power ballads when I ride. Ugh, keep getting gremlins in my teeth. See?
Geico Motorcycle. 15 minutes could save you 15% or more.
Thank you all for presenting your incredibly amazing solutions. It was so cool to see the innovations you've come up with, and you've thought through so many details of these solutions, and it's just absolutely impressive, I think, for all of us to see high schoolers doing something that none of us would be doing in high school, at least speaking for myself, but really cool and awesome to see what you guys have been working on.
Thanks, Morgan. We really had a tough time with this one. You are all so impressive. And the fact that you are finalists among what Vaso said was 800 plus entries, that itself, I think you should pat yourselves on the back. That's so incredible that you're finalists. We thought you all took on some of the most complex topics and challenges head on. There was a fearlessness with which you approached your solutions. You really went deep with looking at what the problems were and how to best your research was quite inspiring to us. It's relevant to the times because for the last year, at least, we've all been focused on health and wellness and human connection. And so the way you're thinking about it, I think you will help us all moving forward. Your presentations were simply outstanding. You were so well prepared. Your slides were great, and we were impressed with how you answered some really tough questions from all of us. We thought all of you, I think, would benefit from learning more about community partnerships because that came up as a possible suggestion. And for some of these community-based solutions, it's great when you can bring partners along with you. So we hope that you'll consider that. We have a little bit of feedback that I'll share for each group, and then we'll announce the winner. So group one, Paulina and Alexis, we thought you really did great with tackling the problem of access. You had really thought about the space quite deeply, the design of the overall pod, and how technology could solve a lot of those problems. You considered the means for enabling and furthering care, and you really did go quite far in questioning the notion of health. We appreciated that you considered audiences with disabilities, and you also thought about your design being adaptable to the communities that they were in. So all of those were strengths. What we thought you should think about a little bit more was, of course, the people aspect of your solution. How could you think about this more as a system, not only from the point of diagnosis and conversations at the front end, but actually the care at the end of it, and how people would access not only care, but medications and other services, and how you could get the community more involved. So if you were to think about it more from a people-centered solution versus a space-centered solution, what might you do differently? We also want you to think about things like maintenance and unintended consequences, and how will this be delivered? And maybe as you think about moving your idea forward, that you actually think about role play. What would it be like to walk into a pod, and what would that experience be that might help you think about enhancing the experience? But overall, bravo, that was quite amazing what you did. Over several weeks, we could see that your idea really evolved from what you had initially proposed. Allison, we absolutely loved that you took such a user-centered approach. You were so people-centered. You thought about mobility. We appreciated that you used anecdotal data, and you really looked at the social dimension of health. You were really explicit with where your data was coming from, and you presented the ethnographic data in such a rich way and showed not only talked about the data, but you showed how it actually affected your design and impacted your design. We think you had such an honest approach to research that we were blown away. If there's a small point that we might suggest is to think more about how you framed the problem, and that might take you further as you think about evolving your idea. Group 3, we appreciated that you were from 3 different schools and you still collaborated, and that said a lot about not only that spirit of collaboration, but your very interdisciplinary approach to your solution. You leaned into care as a verb, which impressed us. We were also really impressed by how you tackled the very tough questions that my fellow judges and I put in front of you. And we would love for you to think more about and analyze what are those popular notions of health and what it means to be healthy as you continue to evolve your design. But I would say we had such a tough time because each of you impressed us. For a moment there, we thought you could stand shoulder to shoulder with professionals out there. And some of the judges actually felt like we were working on solutions that you proposed, but you actually took it much further than any of us had seen out there. So we are blown away. We feel very optimistic about the future, and you left us inspired. So a round of applause to all of you. That was really inspiring. And so we did pick a winner, but I want to assure you that all of you, for us, this was so tough, but we felt like Group 3, you are the winners of this year's competition. Congratulations. It was a tough topic. We appreciated that all of you thought about how to advance your ideas, but to take on the challenges that you took on, the innovation was what really blew us away. You brought a balance to your ideas of thinking about high tech versus low tech, and you really looked at the problem in many, many different ways. So congratulations, and my colleagues and I look at your idea moving forward and hope to see it out in the market someday. Thank you.
Congratulations again to all of our finalists and the winner of this year's high school design competition. Thank you all so much for watching.